This is The Week in Addiction Medicine, a podcast resource of timely news and top stories brought to you by the American Society of Addiction Medicine, ASAM.
Today is Tuesday, March 24th, and I'm Zach Caruso. Our lead story this week is in addiction and is titled Cost Effectiveness of Contingency Management for Methamphetamine Use Disorder, a model-based analysis. This study used a microsimulation model of methamphetamine use behavior among individuals with methamphetamine use disorder, or MethUD, to assess the cost effectiveness of contingency management, or CM, for MethUD. Both 12-week and 24-week CM programs were modeled using a maximum incentive of $750 per patient per SAMHSA guidelines. The model simulation was run for a cohort of 10,000 individuals with MethUD and looked at lifetime cost. Compared to no treatment, the model predicted an estimated net gain of 0.70 quality-adjusted life years per person at a cost of $6,850 per quality-adjusted life years for a 12-week program, with an incremental cost-effectiveness ratio, or ICER, of $9,830 per quality-adjusted life years. For a 24-week program, the benefit was 0.81 quality-adjusted life years at a cost of $10,000, yielding an ICER of $12,312 per quality-adjusted life years. This suggests that both durations of CM for MethUD are highly cost-effective, even at the maximum level of incentives. Next is an article in the Harm Reduction Journal titled Celebrating Each Success: Proportion of Remission as a Measure of Recovery from Polysubstance Use Disorder, Proportion of Remission, a Recovery Measure. This remote cross-sectional study introduces the concept of proportion of remission, or PRR, that provides a more granular and nuanced measure of recovery in individuals with a history of 2 or more substance use disorders, or poly-SUD, and investigates its association with various quality of life, or QOL, domains. It also reports on individual SUD's contribution to QOL. PRR was significantly positively associated with environmental, psychological, and social QOL after adjusting for covariates. Across SUDs, individuals not in remission exhibited significantly lower QOL compared to those in remission, with stimulants having the largest effect sizes. The authors propose a novel construct of poly-SUD recovery, proportion of remission. The results indicate the potential of PRR to capture gradual improvements in quality of life and reflect recovery progress. Our next article is in JAMA Internal Medicine and is titled Health Plan Disenrollment and Mortality After Initiation of Medications for Opioid Use Disorder. This study is an open-label, non-inferiority randomized clinical trial of extended release, or ER, versus sublingual, or SL, buprenorphine for opioid use disorder, or OUD, in pregnancy through 12 months postpartum. From July 2020 to October 2024, 140 pregnant individuals between 6 to 30 weeks gestational age were randomized to receive either SL or ER buprenorphine across 13 peripartum OUD treatment sites. ER buprenorphine was found to be non-inferior to SL buprenorphine. Participants on ER buprenorphine had higher rates of illicit opioid abstinence during pregnancy, but they were similar postpartum between groups. The ER buprenorphine group had fewer serious adverse events during pregnancy and postpartum. There were no significant differences in infant neonatal opioid withdrawal syndrome treatment or duration of infant hospitalization between groups. Our next article is in Substance Use and Misuse and is titled Severity of Polysubstance Use Among Young People Seeking Drug and Alcohol Treatment and Social and Mental Health Correlates, an Observational Study. Polysubstance use, or poly-SU, is common among people seeking alcohol and other drug, or AOD, treatment and peaks among young people, decreasing after age 25. Researchers assessed poly-SU among persons aged 12 to 25 in outpatient or residential AOD treatment and identified 3 poly-SU profiles: 1. Extended-range poly-SU, 2. High-risk opiate use with extended-range poly-SU, and 3. Moderate-range poly-SU. Researchers noted Profile 2 was associated with homelessness, recent hospitalization, lower rates of employment or school, and psychosis. Profile 1 and 2 were associated with being in residential treatment, risky behavior including overdose, depression, and anxiety. Next is an article in Scientific Reports titled Complementary Services Improve Recovery Outcomes Among College Students with Alcohol or Other Drug-Related Use Disorders. Students in the National College Health Assessment who reported they had been diagnosed and or treated for an SUD completed a survey to assess SAMHSA's 4 domains of recovery: health, home, purpose, and community. Each domain was scored on a scale of 0 to 100, and the 4 domain scores averaged for an overall score. In this group, 19% received no treatment, 3% medication only, 50% therapy only, 21% therapy and medication, 4% were part of a 12-step program, and 5% other treatment. Those in a 12-step program had the highest overall score, as well as the highest score in each of the 4 domains, while the no treatment group had the lowest overall score. The overall score for medication only was 65, therapy only 65, therapy and medication 68, and other treatment 67. Significantly better recovery outcomes were seen with 12-step programs and combined medication and therapy. Our next article is in Translational Psychiatry and is titled microRNA 132/212 negatively modulates opioid reward by targeting dopamine transporter in the ventral tegmental area. Using a Luciferase reporter assay, this study discovered that repeated morphine administration decreases the expression of microRNA or MIR 132/212 in the ventral tegmental area or VTA and induces a concurrent upregulation of the dopamine transporter or DAT. It also found that the DAT coding gene SLC6A3 mRNA3 UTR is a direct target of MIR 132/212. These miRNAs negatively regulated both mRNA expression and protein levels of DAT in vitro. The findings uncover a regulatory mechanism wherein MIR 132/212 modulates morphine-induced reward behavior by fine-tuning DAT expression at the post-transcriptional level, providing a potential therapeutic target of rewarding effects. Next is an article in Drug and Alcohol Dependence titled Foodie Traps Within Facebook Cannabis Promotional Posts, Deploying Multimodal Deep Learning AIs to Monitor Audience Engagement. Researchers from university departments of communication and computer science used machine learning and large language models such as ChatGPT-40 to analyze visual and text content in 27,000 Facebook social media ads for cannabis in 2021 and 2022. They found that warm hues and the colors red, yellow, and orange increased engagement. Visual food cues were found in 18% of ads and increased comments, shares, and likes. In tobacco ads, food cues attract adolescents, and food cues in cannabis ads warrant regulation. Claims of health benefits appeared in 47% of ads. These claims typically included stress relief, improved sleep, and the suggestion that cannabis is part of a wellness lifestyle. Mentions of potential risks were rare. Our final article is in the Journal of Addiction Medicine and is titled Detecting Suicidality in Opioid Use Disorder Requires an Understanding of Intentional Opioid Overdose. Suicide by opioid overdose has more than doubled since 2017, but current suicide risk screening tools may be inadequate to identify those at risk. In this commentary, the authors review some of the unique risks associated with OUD and the need for a new screening tool that accounts for these factors. Persons with OUD have increased risks of comorbid psychiatric disorders and chronic pain, which put them at an increased risk for suicide. OUD is also associated with negative emotional states, including dysphoria and anhedonia in withdrawal periods. The authors note current screening tools fail to detect history of intentional overdose, as patients often don't report these as suicide attempts and may not always recognize their intent as suicide. This concludes today's episode of This Week in Addiction Medicine. Remember to subscribe to the ASAM Weekly for more exclusive content and our editor's commentary delivered every Tuesday. Be sure to check us out on social media and at asam.org. Thanks for listening. We'll be back next week.